I'm glad you could all join us. This is one of the series of virtual programs that the Macular Degeneration Association is hosting regarding various issues concerning eye health. My name is Larry Hoffheimer, and I am the founder and chairman of the Macular Degeneration Association. I want to thank our sponsors, Regeneron, Apellis, Novartis, Alexion, Total Vision for their support for these conferences. These conferences are not only virtual, we are doing in-person conferences as well. Today, we're going to talk about dry eyes. Why are my eyes dry? I'm proud to say we have an illustrious speaker who happens to be optometry medical director and is one of the best known medical people in the field of optometry. He has participated in a lot of our programs and gives good leadership to our organization. He has published numerous studies and articles in scholarly journals. He practices at the Grin Eye Care in Leawood, Kansas. So it's now my pleasure to introduce to you our first speaker, Dr. Jeffrey Gerson. Dr. Gerson.
Good morning, everyone. Thank you, Larry. And most importantly, thank you to everyone for being on here today. I'm just trying to share my screen here real quick. Give me just a second while I get this pulled up. Bear with me. Now, some of you may be wondering how or why we're talking about dry eye, even though this is Macular Degeneration Association. And really, it's a good question. But the answer is because just because someone does, or for that matter, does not have macular degeneration, doesn't mean that they can't, don't, or won't have dry eyes as well. So I think it's important that we kind of expand our horizons on what we talk about because of the different things that are possible. I think everyone can probably see my screen, so let's get on with it. So why are my eyes dry or watery? And I added in the or watery because sometimes people with dry eyes, their eyes are actually really watery. And to a lot of people, that just doesn't make sense. If my eyes are dry, why are they watery? What's the deal with that? And I'll talk about that. Because again, what I'm trying to do is I'm going to try to answer questions that I get in the office virtually every day. Because if I get these questions every day, then I kind of assume that some similar questions to what you all may have. All right, so, I want to start off by saying dry eyes it's a really complicated condition. And actually, really medically speaking, we probably don't call it dry eyes anymore. We call it ocular surface disease. And saying that the ocular surface, the front of our eyes, become diseased because it's not just a problem of being dry. So it's a very complicated condition, and it can cause your eyes to feel dry, gritty, like you've got something in them. It could cause your eyes to be red, sometimes even a little itchy, or sometimes people just say, my eyes feel tired. Sometimes eyes that are really dry can be very watery and wet. And I'll kind of explain this later, and I'll talk about an analogy that I use both in macular degeneration and dry eye and other things as well. It's a matter of quantity versus quality. So the quantity and quality of your tears, both are really important. There's many different causes and many different potential treatments, and I'll go over exactly what some of those treatments are. And you'll see it's kind of a dizzying array of different things that can be done for dry eyes. So unfortunately, it's not just as easy as saying, I think my eyes are dry, I'm going to go to the store and get some artificial tears. That may help many people, but that's not going to be the fix for some. So like many other things, and like you'll hear me say oftentimes, really important to consult with your eye care provider to find out A, exactly what's wrong, and B, how to remedy that. Again, same as macular degeneration. So I'm going to start out with a video to kind of demonstrate how complicated our tears really are. And this is more, to be honest, a video that I would show to a group of optometrists, but I want to show it to you just so you get an idea of how complicated tears are, that it's not quite as simple as saying, well, I'm going to add water to my eyes. It's not that easy. And I want to make sure that you get that sense of what this condition really is. By the way, at the end, there will be a few slides that show some of the many different available treatments, whether they're drops you can purchase, because I would imagine that's something I'll get some questions about, like which eye drop is the best one. And I'll answer that at the very beginning here. It depends. So there are many, as you'll see later, many different treatments for dry eyes. And it just kind of depends on what's causing your eyes to be dry or red or irritated. What's causing it for you dictates what the best treatment is for you. So with that being said, let's jump over to the video in just a minute. But before I do, I want to make one or two more quick points. First off is that dry eyes are not caused by AMD and vice versa. So just because we as the Macular Degeneration Association are putting this on, we don't want you to think that one causes the other. But as it turns out, both are more common as we get older. Dry eyes and dry AMD, they both have the word dry in them, but they're not related. They're really not the same, other than they both have inflammation as part of what causes them. And in the same token, wet AMD and really wet or watery eyes also have nothing in common. So I wanted to point that those simple points out. And again, some very simple, good advice that's, I think, really important. Because again, this is something that I hear all the time. Drops to take the red out aren't ideal for most people, especially people that have dry eyes. There are quality drops for taking the red out. And when used appropriately, they're fantastic. I'll tell patients they're like magic, but they should be used as directed when appropriate. Because usually there's something at the foundation of why your eyes are red. And we really need to address the foundation and not just the symptoms. And I'll go over this a little bit later, but the analogy I use of this is that of a house renovation. If you're redoing your house, you're redoing your kitchen, you put in all these beautiful finishes, the backsplash and the appliances and the countertops, and everything is beautiful. But you have problems with the foundation, and the foundation shifts and everything cracks. Your finishing touches didn't matter. Well, the finishing touches are like the drops to take the red out. The foundation is whatever the cause is of the dry eyes that's causing, or whatever it is that's causing the redness. We have to address the foundational issues before we try to beautify and pretty things up. And so again, that's why it's important to consult with an eye care provider. Why are my eyes dry? Why are my eyes red? What can I therefore do about it so that I don't suffer those symptoms? All right. So as I already kind of mentioned, this video I'm going to show is something that would normally be shown to doctors. So it's kind of a technical level of video, but I think you'll get the idea. It's about 1.5 minutes, and it explains just how complex our tears are. And there's a bunch of other videos in this talk, most of which I got from my good friend and colleague, Dr. Mile Brujic, who is also on the Optometric Medical Board of Macular Degeneration Association with me. So I just want to acknowledge Dr. Brujic. He's also done a number of talks for Macular Degeneration Association last year. So I thank him for his contributions to today's talk. So I'm going to share with you this video, like I said, 1.5 minutes to 2 minutes, and then I'll be with you as soon as it finishes.
Is a condition caused by changes in the quantity or quality of your tears. The tear film comprises 3 layers. The outer lipid layer includes components like cholesterols, fatty acids, and phospholipids. Some components serve to increase lubricity and prevent evaporation, while other polar lipids can join with some of the mucins to create greater cohesivity of the tear film. The middle aqueous layer contains numerous essential nutrients supportive of the ocular surface environment. It is water-based and includes components such as lysozyme, immunoglobulins, sodium, and some soluble mucins. The mucin layer components include silicic acid, hyaluronic acid, and mucins such as MUC 1, 2, 4, 16, and 5AC. Some mucins form a cushioning viscoelastic matrix that both protects the ocular surface and provides the even surface necessary for good vision, whilst other mucins function in a glue-like fashion, securing the tear layer to the microvilli and glycocalyx. If tears break up too quickly, the mucins no longer function adequately to sustain tear layer cohesion and surface protection. This may be observed clinically as areas of rapid fluorescein breakup. As the tear film breaks up, the lipid and aqueous layers dry up, causing the mucin layer to diffuse away, leaving the ocular surface bare and exposed. This enables an inflammatory cascade, and sometimes irreversible damage occurs. The patient becomes increasingly symptomatic and often experiences visual disturbance.
Plus, I always like it when we can have someone that has a cute accent, you know, sounds better than me. So again, that just kind of shows how complicated our tears are and what's really going on. It's not just a matter of splash some water in my eyes and that will make things better. So I mentioned this idea of quantity versus quality, and I think it's really important. And what's important is that we have kind of an equal balance, as we see on the left-hand side here, of good quality and good quantity. Because if it's all one and not the other, then things get kind of out of whack, and that can create some problems. So the image on the right are two different fish bowls. One has a whole bunch of fish, a whole bunch of goldfish, that if you go to the pet store, each one of those probably costs you $0.25. I don't know, maybe with inflation, they cost 50 cents. And on the right, there's two beautiful, colorful saltwater fish. There's only two of them, but those two fish probably cost more than the whole bowl on the other side. And they're clearly, or maybe not clearly, but at least to me, more beautiful. And so on the left, all the goldfish, that's quantity. On the right, those are beautiful saltwater fish, that's quality. And so that's how we need to think of our tears, which is also, by the way, how we need to think of our diet, our supplements, whether it's dry eyes or macular degeneration. So I'm going to try to draw some parallels between dry and macular degeneration. Even though I stated that they're two separate and distinct and independent conditions, I still want to draw some parallels because I think that that's important, that we keep macular degeneration at least part of most of our conversations. So this whole idea of quantity versus quality, and it's a really important one. And that also explains why you can have dry eyes, but your eyes be watery, because you got a whole bunch of tears that aren't doing the right thing, that are poor quality. So it's kind of like this feedback loop that our eyes have with our brain. When our eyes feel dry, we basically send a message to our brain that says, hey, we need more. Our brain sends messages to the glands that make the tears that says, make more. So we make more. But if they're not good quality, our eye sends a message back to our brain saying, hey, we still need more. And the brain sends a message back to the glands that make the tears, says, hey, keep on going, make even more. And so that just keeps going, where we make more, more, more. But if they're poor quality, our eyes still don't feel good. And that's when we have eyes, it looks like we're crying, but we'll be complaining of our eyes being dry. And it's a really confusing concept, I know, but it's one that I discuss with patients literally every day. When someone says, well, my eyes feel so dry, or my eyes are so irritated and red, why is that? And I say, well, you have dry eyes. And they say, well, that's impossible, because it's always like I'm crying, my eyes are always running. And that's when I explain it's quality versus quantity, a really important concept. So this is just showing that when people have dry eyes, there's generally two different things that are qualities or quantities that can cause the dryness. So evaporative means that it's poor quality, that our tears evaporate too quickly. And I'll actually show you some videos of people with tears that are evaporating. So our tears evaporate too quickly because they're abnormal tears or something else going on. That's poor quality. And then aqueous deficiency, that just means not enough tears. So that's clearly a quantity issue, low volume. We just need more. So two different things that can cause dryness. I know this is a busy graph, but I wanted to just make the point that we have these two kind of diverging issues. Now, by the way, somebody can have both poor quality and poor quantity. So if you have both of those, then it's going to be a real issue. And we'll have to address it in multiple ways, because as you can imagine, the way to help address quality is different than the way we address quantity. So as it turns out, so far we've just been talking about your tears, how complicated they are and complex, and the quality and quantity of your tears. But sometimes our eyes are dry because of something other than our tears, or at least in the tears we produce. So some of you may have heard of the term blepharitis. So blepharitis sounds like a mean, nasty disease, doesn't it? It sounds kind of scary if someone were to tell you, oh my gosh, I'm sorry, you have blepharitis. And as it turns out, blepharitis is very common. If I were to see all of you as patients in my clinic, I would venture to guess that probably 80% or more of you have some form, some amount of blepharitis. What blepharitis means is inflammation around the eyelids. So a couple different ways you see it here. See these kind of reddish lines? Those are inflamed blood vessels in the eyelids, inflammation of the eyelids. If you look here, and I'll show you some other images here coming up, there's some kind of gunky stuff at the base of eyelashes. So what we're looking at here is an eyelid, eyelash, and some gunk at the base of the eyelash. I know that's not a medical term, but I'm not going to bore you with all the medical terms. But when you have flaky, gunky stuff along the eyelids, you probably have blepharitis. So you could ask yourself, boy, do I seem to have a lot of sleep in my eye when I wake up? Or do I get kind of people call them the crusties? Do I get the crusties in my eyes throughout the day? If so, you likely have blepharitis, which, like I said, is very common. And if someone has blepharitis, it will cause irritation and inflammation on their surface of their eyes and mimic dry eye syndrome. So can create eyes that are dry, but different than just tears. So you can imagine if you got a bunch of gunk along your eyelids that's getting into your eyes and causing inflammation, if all you're doing is adding water or tears, well, that doesn't really help. Remember, we can't just put on the pretty finishes. We need to address the foundation. So in a patient with blepharitis, we need to do that by addressing that inflammation along the eyelids. So here we see, this is what, as a doctor, I would be looking at through the instrument when we look at your eyes. And we're kind of zooming in, and you see at the base of those eyelashes, all those crusties. There you see one a little bit farther down on the eyelash, that big clump of crusty stuff. And this is just another view of that video. If you're in the middle of eating your lunch, I apologize. There'll be a couple other similar videos like this. But again, as you can imagine, that gunky stuff getting into your eyes can cause irritation. And so in many people, that is in fact what needs to be addressed. So here we can see the problem in higher magnification again here on the right, where we see this gunky stuff. And sometimes that's caused by overgrowth of bacteria. Actually, very oftentimes it's caused by little mites called Demodex, which sounds kind of scary and gross, but it's not really either. But this is what, as a doctor, what I'll be seeing when I look through the little instrument. When you're sitting there, you have your chin in the chin rest and your forward up against the little bar. And I'm looking through, it looks like a little, I don't know, like a little microscope thing at your eyes. This is what I would be seeing. And here we have someone before and after some treatment for their blepharitis. So on the left, you can pretty clearly see the chunks and the gunk and stuff along the eyelids and eyelashes. And on the right, it's gone. We don't see that anymore. And so this person on the right is going to be much happier, not because they or anyone else can really see that gunky stuff, the sleep, the crusties, but it's because their eyes will feel better, because that crusty stuff won't be getting into their eyes, causing inflammation and irritation. So what you might be asking is, it says before and after treatment, how is blepharitis treated? Well, sometimes it's treated with very simple means. And so what I use with my patients most commonly, so I believe in always starting with something that's really simple, easy to do, and ideally inexpensive. And so kind of the first line treatment for blepharitis that's super easy and really inexpensive is what I call heat and hygiene. And what that means is just making part of your day where you take a warm washcloth and hold it over your eyes for 20, 30 seconds, and then gently kind of rub along your eyelids and eyelashes. Now, some of you may have been told to use baby shampoo. That's fine. I don't have any of my patients use baby shampoo, number one, because it complicates it. Number two, even though it doesn't sting, I still think that sometimes it gums up your vision and people don't really like it. And number three, like I said, it adds a layer of complication. I want to make things so easy that there's no excuse not to do it. And I guess number four is I'm not convinced that people do any better with baby shampoo versus just doing it with a hot washcloth. Now, you can become somewhat fancy with this, and there's different types of what are called lid wipes that you can buy in the store or on Amazon or wherever you want to go. Most of them just have some very gentle cleaning solution in them where you just hold it over your eyes. It's a moistened cleaning solution that's safe and comfortable for your eyes, where you just take these lid wipes that you get at the store or at your doctor's office and gently wipe along your eyelids and clean off some of that blepharitis, some of that junk. There's even ones that are self-heating, where they're almost like the hand warmers, where you take them out, you just kind of press them, they warm up, and they have cleaning solution, and you just hold it there for 20, 30 seconds, then just kind of wipe a little bit and do that in the other eye. That's the very simple. The next step are there sometimes medications. So sometimes we prescribe eye drops or ointments. And remember, I said that this can be caused by overgrowth of bacteria. So when we have too much bacteria, sometimes what we need is an antibiotic. And so sometimes we use different antibiotic drops or ointments, or even drops or ointments with antibiotic and a steroid in them. Steroids decrease inflammation. And when you have all this excess gunk along your eyelids and eyelashes and some of the bacteria, it can become inflamed, and a steroid might help. So medications that may be prescribed by your eye care provider. And there are also some in-office treatments. Now, the good thing, the positive side of these in-office treatments is they tend to work really well for cleaning up the excess junk on your eyelids and eyelashes. Because sometimes, no matter what you do at home, you just can't really get it off, and we need to do something. We need to do more of a deep clean. And so sometimes there's in-office things that can be done, and they can work great. The downside is, as of at least now, they're generally not covered by insurance, and it's an out-of-pocket expense. And some of them are more costly than others. Some of them are fairly inexpensive. But the bottom line is, in-office treatments for this generally are not covered by insurance, whether it's commercial insurance, Medicare, or whatever you have. And there will be some out-of-pocket costs. Now, what else can be causing inflammation or irritation? So in our eyelids, both the lower and upper eyelids, we have these glands that produce oils. And these oils coat our tears. So if you remember from the video, there's basically 3 layers of tears, and the top of which is an oily layer that kind of coats and covers our tears. And we need a good oily layer to protect the watery layer below. And if the oils that are coming out of these glands aren't the right quality, then they don't help coat and support our tears. And that causes our tears to evaporate much more quickly. So the oils that they produce from these glands should look more like olive oil when they're expressed. So what I mean by expressed is, if I take your eyelid and I just kind of squeeze it just a little bit towards the, towards the I guess the border of your eyelid. If I squeeze like that, then I should be able to get out what looks like olive oil. Or if I just kind of press gently along your eyelid to your eye. And so, which is something that we do in the office quite frequently, and there's no pain. It's really easy to do. And what comes out should look like olive oil. But in some people, it can be kind of thick and yucky and look like toothpaste. And it looks like I cut off the word, but this would be bad. We don't want, when we press on it, we don't want it to look like toothpaste. We want it to look like olive oil. Imagine going to eat your salad and you think you're putting olive oil on it. How surprised would you be if what came out was toothpaste? You wouldn't be very happy with the salad dressing, would you? Same thing on our eyes. Our eyes aren't very happy if our tears are covered with a toothpaste-like filmy layer instead of a nice, even olive oil coating. So here's an example of, and this is from, again, from Dr. Bruzek, as you can see on the label of the video. This is using a little instrument trying to squeeze those glands. And sometimes if we squeeze those glands and nothing comes out, then we don't have enough of those oils to coat our tears. But here you can see what's coming out is certainly thicker than olive oil, much more like toothpaste than olive oil. So you can kind of see, so I'll point when it's, you can see my pointer, he's going to move over here a little bit and I'll show you. It looks like almost like a little fountain, a little geyser coming out. But there you go. See those little columns coming up? That's really thick. That's not good. So the oils that are coming out for this person aren't going to coat their tears very well. So we need to get that thick stuff out and help normalize the oils so that when they are covering our tears, it'll be a much more even, clear coating. That's a really good example. Again, I apologize if this grosses you out. I don't know if any of you watch the TV show Dr. Pimple Popper, where it's a dermatologist that just has a half-hour show that she just does stuff like this. It's gross. But for eye doctors, this is pretty cool. This is kind of cool, fun stuff. So I thought maybe you'd appreciate getting to see what some of this could actually look like, because you might hear someone talking about, well, the oily layer or the thick stuff. And I wanted to show you what that kind of looked like so you had a better idea. All right, so how do we treat someone if they have problems with these glands? If what's coming out is thick and toothpaste-like and not oily? Again, it can be very simple. Again, that's kind of my motto. It's kind of my MO, the way that I do things. And so the simple way would be what I talked about for blepharitis. So using heat. And so using heat to help open those glands. And instead of just a quick wipe, almost a massage. So heat to open the glands, and then a little bit of massaging along your eyelids to help push the oils out, trying to continually clear out those oils, because sometimes they get kind of stuck there and they become stagnant. So even olive oil, if it gets stuck and sits too long, can become kind of a different consistency, what I would call kind of turbid, kind of cloudy. So we need to keep those oils flowing. So oftentimes, as simple as a little bit of heat, a little bit of massage, and I tell people it should feel good. By the way, another way you can get heat for your eyes, if it's not just a warm washcloth, go to some spa and buy one of their masks, like one of those little beaded masks that you can heat up in the microwave and then just put on. Boy, it feels really good. And so if it feels good, do it for a couple minutes. But then when you're done, a little bit of massage. So it's kind of like your own self-done spa treatment. So the first treatment for the glands, very simple. The next step would be that it could be medications. So those medications could be topical drops, so drops that we put on our eyes. It could be ointments that we kind of layer either in our eyes or along our eyelashes. Or sometimes it could be prescription or over-the-counter oral medications. So for example, a very common cause of these glands being clogged up and causing irritation to our eyes is people that have what's called rosacea. You may be familiar with that when you've heard of acne rosacea. So if when you were younger, you had bad acne, it likely affected your eyelids also. Very underdiagnosed. And if it's affecting your eyelids, it's probably affecting the oils that come out. And if it is, just adding tears to your eyes won't do much. So a lot of times we use an oral antibiotic, and probably the most common for this is something called doxycycline. So it's actually a very old, inexpensive antibiotic that can be very helpful for this. Now, as it turns out, something that's over the counter that can be helpful in many cases for this is fish oil. So you've all probably heard of using, or many of you probably take fish oil. And so taking fish oil can be really helpful for the oils in these glands. And then just like blepharitis, there can be in-office treatments, which again will be out-of-pocket expenses. They are generally not covered by insurance. Now, when I have to tell people that, there's something we can do in the office and it's not covered by insurance, I'm just the messenger. And so coming to you and telling you that, I'm just the messenger. Hopefully you appreciate the information and knowing there's in-office procedures, but it's not my, fault that insurance doesn't cover these. It's unfortunate that insurance doesn't cover these, but we're fortunate that there are options for things that can be done. So something that doesn't get talked about very often, but is also fairly common, is something called floppy eyelid syndrome. What is that? Well, it's just what it sounds like. It's someone that has really floppy eyelids. It's where, in general, as we age, our skin becomes a little more lax and it's not as tight. And we notice that in different places that we don't like. But one of the places it can happen is around our eyelids. And this can certainly be a cause of dry eyes, because what happens is our eyelids then aren't right along our eyes. Think of your eyelids as being like wipers that are continually smoothing out the tears in your eyes, wiping away junk that's in your eyes. And if you got a bunch of junk on the windshield of your car and your windshield wipers aren't actually touching the windshield, they're not doing any good. So if our eyelids aren't actually touching the surface of our eyes, they're really not doing very much good. So floppy eyelid syndrome is something that's real that can lead to chronic irritation. And let me show you how we can look for it. So these are people that have floppy eyelids. The one on the right, their lower eyelid is being easily flipped over. The one on the left, that's their upper eyelid. That was very easily flipped over just by pulling it up. So the doctor just barely pulled on their upper eyelid and it flipped over. And the one on the right, you just barely pull down the lower eyelid and it flips over. So those are floppy eyelids. And so basically when that happens, your eyelids aren't really touching your eye the way they're supposed to. They're not interacting with your tears the way they're supposed to. So our eyes become dry and or irritated. Now, so if someone has floppy eyelids, what do we do about that? What do we know about that? Well, we know that it is way more common in people that sleep on their stomachs and people that have sleep apnea. So if someone has sleep apnea, those are people that stop breathing for short periods of time throughout the night, that addressing that can ultimately help with their floppy eyelids. And these are people that may need to be referred to general physician for testing for sleep apnea or to a oculoplastic specialist. So someone that's an ophthalmologist that does plastic surgery on the eyes to help kind of tighten the eyelids so that they better oppose or touch along the eyes in order to wipe and clean the tears. So this may be something you've never heard of, but it's something that, you know, if you try all these different drops, well, they're not going to help, right? Because if it's a wiper issue and your wipers aren't actually touching your windshield, it doesn't matter what cleaner you spray on the windshield. You need the wipers to help to clean. So this is something that is also fairly underdiagnosed, but could be really helpful if it is addressed. So now what I want to touch on is something called tear breakup time. And I'm going to go about another maybe 10 minutes and then hopefully get some more questions. We've got a couple waiting in the queue, which I see. So thank you for those coming in. Tear breakup time is how long it takes your tears to kind of dissolve, which is a quality issue. So if I have a patient blink, 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 and just kind of open their eyes and stare, with dyes that I use in the office, I should be able to see how long it takes for their tears to start kind of fizzling away and breaking up. And it should be at least 10 seconds. And it's generally much shorter in people with dry eye problems. It's easily measured by your eye doctor. It's actually something you can measure pretty easily. The way you can measure it is find something on a wall that's fairly small and not hard to see, but also not something huge, something with some detail. Blink, 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 hold your eyes open and see how long it takes for that to start to kind of fade away a little bit. And what's happening is as your tears break up and you no longer have that nice, clean, smooth surface on the front of your eye, your vision starts to blur. So some people, their biggest symptom of their dry eyes is my vision gets blurry when, and it's generally when they read, drive, watch TV, or are using a computer, because those are activities where we stare, where we don't blink as often. And if your tears are breaking up every 5 seconds, well, when you're staring at a computer screen like you are right now, you don't blink every 5 seconds. So your eyes may be drying out and you may be noticing it on activities like this. So here, what we see is the yellowish green coloration is a dye, a coloring dye we put in someone's eye. So you can see that there's little patches where it starts to break up. So after the person blinks, it should take at least 10 seconds. But as you'll see in these photos, especially the one on the left there where it's completely broken up, it is certainly less than 10 seconds from a blink till when these tears start to break up. So let me show you that again on the left side here, and you'll see what I'm talking about. So blink, blink, 1,000, 2 1,000, 1,000, 2 1,000, and look, the tears are already breaking up. So within 2 seconds, 3 seconds of blinking, this person's vision starts to get worse. This needs to be addressed through quality. So, all right, so here we have it. So traditionally what we do for treating dry eyes is topical treatment where we use some sort of eye drop, oftentimes artificial tears. But there's other things we could do as well. So do omega-3s work? And as it turns out, there's studies that show benefit and some show that there may not be as much benefit. There are no studies that show that it doesn't work, but omega-3 generally is helpful when it comes to dry eyes. But just plain omega-3 is not the answer. You need to look for what's called EPA and DHA. And that's what I'm kind of hovering around there. And if you're going to take a supplement for dry eyes, you want at least 1,000 milligrams of the EPA and the DHA. So combined between those two things. So quality is very important because it helps decrease inflammation. Best way to get fish oil is eat fish, which is not the same as taking fish oil. You're going to be better off eating good, quality, not fried fish than you are by just taking fish oil. Fish oil is better than nothing, but eating fish is going to be even better than that. So I have a question: drops, ointment, or plugs? Which drops, vials or bottles? What if dry or blepharitis? So I'm going to touch on that here in just a second. So I will get to that. There's a question that I will touch on before I get to the specific tears. Can you use artificial tears too much? Well, that's a good question, because sometimes we think that, if something's good, more is better. As it turns out, a lot of tears, most tears actually, as it turns out, have preservatives in them. And if you keep dumping preservatives in your eye, it can actually make irritation or inflammation worse. So too much of drops that have preservatives can actually create issues. Generally, drops that have preservatives are in a bottle. Almost any bottle that has tears, unless it's very clearly stated, if it's in a bottle, it'll have preservatives, unless it says something different. Now, oddly enough, someone else had a question: are preservative-free tears better? I think that most people don't need preservative-free tears. However, if you're using teardrops more than 3 or 4 times a day, number one, probably need to be doing something other than just tears. But number two, if you're using them that often, then using them without preservatives is going to be better. Because like I said, sometimes preservatives can create issues. All right. Ocular surface inflammation. So realize that the biggest cause of the irritation and dry eyes is generally inflammation, which causes the glands that produce tears, which are different than the glands that produce oils. It causes those glands to not produce enough tears and lesser quality tears. So the aim of some of the prescription treatments like cyclosporin, which is something that's been around for a long time for eye drops, the aim of using cyclosporin eye drops is to produce more and better tears. Not just more, not just better, more and better. So there was a question about plugs. And so here's actually someone getting these little plugs put in. So what they're doing is, this is to address quantity. So our eyes produce tears, the tears drain out. There's a little drain on the inside corner of both your lower eyelid and your upper eyelid. And what's happening here is the doctor's putting a tiny little plug. It's like plugging up a drain. Like if you plug up the drain in your sink. If you plug up the drain in your sink, it won't make more water come out of the faucet. What it will do is it'll prevent the water that comes out of the faucet from draining. So this is something that we do with some frequency to help plug up the drain. Again, this is something that works well when it is a quantity issue. Doesn't help if it's a quality issue. By the way, this generally takes 30 seconds maybe per eye. It does not hurt at all. When we do this, I don't even put in numbing drops. And when I'm done, generally people say, wow, that was easy. Now, when I tell them about the idea of putting these plugs in, people give me a look like I'm nuts. Like, you want to do what? What? And after we do it, they generally say, wow, that was easy, no big deal. So that is another option for treating dry eyes. Another one that I've been doing more and more of, and is becoming more common, is using what's called an amniotic membrane. So amniotic membrane is the innermost lining of a placenta, the amnion. It shares the same cell origin as a fetus. It acts kind of like stem cells. And so what can be done is a small sheet of these amniotic cells can either be made just that sheet or put on a ring and put into someone's eye. And we generally leave it in the eye for between 3 to 7 days. And basically what happens, all the really healthy proteins and and amino acids and everything else that's in this tissue then gets pulled out by our eye and then feeds into the surface of the eye and heals that drying surface. So the way that I describe this to patients is this is a way to reset our foundation. Remember, I used that analogy earlier. So it's resetting, rebuilding the foundation for which our ocular surface lives on. And it's a way, it's, you know, there's some drops for redness that I mentioned earlier that are kind of like magic drops. These amniotic membranes are like magic as well, because it takes eyes that are incredibly dry and irritated, and it really helps to heal that and reset the foundation for where we're at, so that then when you do use the tears, it helps them to work better. So really our job, or my job as your eye care provider, not yours, but for my patients, is to both provide relief and improve function. Because as it turns out, people with really dry eyes, it's pretty common for it to affect their vision. It's pretty rare. There's a question about whether dry eyes can cause vision loss. It's pretty rare for dry eyes to cause permanent vision loss, although it can, if it's bad enough and it creates scarring. Most of the time, it's a visual nuisance that can be addressed. And so sometimes it's not just I need glasses or a magnifier or something like that to help my vision. And maybe your vision's not good because it's poor quality because of the poor tear quality you have, or your eyes are dry. So my job is to help improve function and help provide relief for you. And there are many different ways to do that. So remember earlier I said there's so many different types of tears. This is just a small sampling of some of the artificial tears that if you go to the supermarket or Walmart or pharmacy and you look at the aisle, you look in the shelves where there's artificial tears, there's a million of them. And some of them are, a lot of them are the same, but some are really different. So again, I would ask your eye doctor what they would recommend that you try. These lipid-based ones, these are the ones to address tear quality. These aqueous ones, these more watery ones, those address tear quantity. These ones that are gels are a little bit thicker. So if your eyes are really dry, these are ointments that are really thick that we generally just put in at bedtime. These are all different. This is just a small sampling of the tears you'll find on a shelf in a grocery store. Now, what about taking something like Tylenol? Well, I guess you could, but if you're taking Tylenol, it's because you're not addressing the root cause. Okay, so then there's mechanical treatments. So to help the function of those glands that I talked about, there's all kinds of in-office procedures that will help with that. And so we do a number of these in my office, and many offices do. Some offices don't do any of these. Everyone's a little bit different. But whether it's using something that provides heat to the lids, then we use an instrument to push the junk out, instruments that measure those glands, masks that heat up the glands, or whether it's something that looks like a little spinning, almost like toothbrush that cleans along the eyelids and eyelashes, or as we mentioned here, the plugs. So there are many different ways that we can address the glands, the drain, or the junk on the lids. And then there are chemical ways that we can treat this. So what I mean by chemical are different sprays that we spray on the eyelid to help with the sprays can help with blepharitis. They can help sometimes with the mites that can get on in our eyelids and eyelashes. There are topical prescribed medications, different drops that help us produce more tears. There's actually a prescription nose spray that helps us to produce more and better tears. Yeah, a nose spray. And then there are oral medications, as I mentioned, both prescription and over the counter, that can help with the quality of our tears. So, there's not a simple, easy answer. What needs to happen is determine the cause, set an appropriate treatment plan with your eye care provider, and then hopefully the goal, provide relief that will improve function. And as we improve function, we provide relief back and forth, and kind of looks like a smiley face. That's because people with really dry eyes are not happy. And when we improve it, they smile a lot more. So my quick summary is that dry eyes and ocular surface disease is complicated. There's not always an easy or singular answer. Sometimes it's drops or pills or in-office treatments. And the bottom line, I think, is seek help from your eye care provider in order to be able to find the right treatment for you. All right, so that's what I have as far as what's prepared. I want to go ahead and answer your questions, but I'm going to go ahead and there we go, and address some of the questions. So I mentioned mites, and there's a question, where do those mites come from? Good question. It's kind of a natural thing. We all have bacteria that live along our skin all over our bodies, and that's normal. And we have some of those mites as well. It just so happens when they start to embed themselves in our eyelashes and in the follicles of our eyelashes that they create inflammation. They're called Demodex. Right now, there's not a prescription treatment for that yet. However, there's one that's being reviewed by the FDA that's an eye drop that may be approved fairly soon. Really good question. My eyes are itchy and burning. Is this a symptom of dry, allergies, or both? Yes. It's hard to tell. Generally, the hallmark sign of dryness is burning, and generally the hallmark sign of allergies is itching. You feel like if you want to do this and kind of dig at your eyes and, oh, that's better, that's usually allergies, but not necessarily, and you can have both. So again, consult with your eye care provider to find out what it is to know what to do about it. All right. Do you need a specialist for dry eyes? If yes, who? Not really. I guess you do need a specialist. You need an eye doctor. It generally doesn't need to be a specialist eye doctor. So as an optometrist, I treat people for dry eyes literally every day. And I use most of the different treatments that I shared with you during, at the end of the talk there. Now, I have a patient, for example, that I was communicating with yesterday that we've tried several of the mechanical things like using warm compresses. We've tried 3 different prescription options, and her eyes aren't really getting better. So for her, I am sending her to someone that's more of a dry eye specialist. There's a question that just says, Restasis ? Xiidra ? So those are 2 of the prescription dry eye therapies that are available, both eye drops. And yeah, they both work very well in certain people. So I have a lot of people that use Restasis. I have a lot of people on Xiidra. I also have a fair number of people on the new medication, Tyrvaya, which is the nose spray. So everyone's a little bit different. So just like in other things, it's somewhat of a matter of trial and error, trying one and seeing how it works for you. But yeah, these are all that I'm talking about right now. Those are all prescription medications to be prescribed. Can you wear contact lenses with dry eyes? It's a trick question, sort of. You need to make sure that it's the right contact lens. You need to make sure that you're having the dry eyes addressed appropriately. People with dry eyes generally don't have as good a comfort with their contact lenses. And so if someone has poorly controlled dry eyes and they try to wear contacts, they're not going to do very well. Can you increase tear production without using artificial tears? Yeah, so there's prescription drops that will help you produce your tear production. Some studies say that caffeine is good. Some say that caffeine is bad. Maybe a little trial and error. Fish oil helps the quality of the tears you produce. So there are ways to kind of alter that. I have macular degeneration. Now I've been told I have dry eyes. Are they related? So yeah, we would think, maybe you think they are. They're actually not related. They're 2 totally distinct entities. So you could have both or one or neither. You could have both of them and one of them easily treated, one of them not. So not really related, except for both are more common as we become a little bit older. I never actually say to people getting older, I just say have more birthdays. Are there factors that can make dry worse? There certainly are. So let me touch on a couple of those because I should have touched on that already, but there are certain medications that can cause our eyes to be dry. Probably the most common offender are antihistamines. So oral medications we take for allergies, oftentimes, just like they dry you up, like in your sinuses or your nose, they can dry up your eyes. So medications can cause dryness. Sitting under a fan. So, if you live somewhere where it's 95 degrees today and you got a fan on above you or a fan blowing on you, that can create extra dryness. Staring at things can cause your eyes to become more dry. Different systemic health conditions, so autoimmune conditions like arthritis, Sjogren's syndrome, lupus, anything that's autoimmune can cause you to have more, or potentially be a cause of dry eyes. Great question. So I don't have any other questions right now. I'll give you just another minute to send in if you have any other questions. I really hope this was interesting, and I would love for any of our attendees to just send in a message and let us know what you think, because obviously this is different than talking about macular degeneration, but we thought it might be interesting to hear about something else. And so let us know if that was a good idea, a bad idea, if there's other non-macular degeneration related topics that you would like to hear about. We'd love to know that. We'd love to know that. We've done it before, and we'd be, we're open to doing it again, but would love to follow your lead.
One, that was a fantastic presentation. It reminds me of the old adage, who's responsible for your health care? It's not your healthcare provider. It's you. And the importance of that is for you to attend events like this, learn, it empowers you. And you've learned a lot today because you took the time to do it. So I congratulate you all for doing that. Back to macular degeneration. Like in many different conditions, early detection is the key to reducing the adverse consequences, namely vision impairment caused by macular degeneration. So the question is, how do you deal with the issue of early detection? Well, you've heard about the AMSLA grid. What you're going to hear about now is a technology, I personally have used it, that will give you an upfront diagnosis of your dry macular degeneration converting to wet, which is the culprit of most macular degeneration vision loss. So we're going to hear from our next speaker, Dr. Megan Blemker, who is an optometrist. She practiced in Nashville, Tennessee. She's currently the clinical director of Nodal Vision in Fort C. Home. She is going to make a presentation and answer questions afterwards about early detection for macular degeneration. So it's now my pleasure to introduce to you Megan Blemker.
Thank you so much for the introduction. Notal Vision is proud to partner with the Macular Degeneration Association, and I appreciate the opportunity to speak to you all today. It is such a privilege. To reiterate some of the important points made in the presentation, I would like to further discuss understanding the importance of early detection of wet AMD and how you can play a role in protecting your vision. 4C Home is FDA cleared and Medicare covered and prescribed by your eye care professional when appropriate level of vision and stage of AMD. It is a form of personalized medicine with the 4C Home device used at home in between your regular eye exams. It detects metamorphopsia or visual distortions in AMD. AMD, or age-related macular degeneration, is the leading cause of severe central vision loss in people over the age of 50 years in the United States. I'm going to share with you the information you need to get informed and take charge of your vision. AMD is a chronic, meaning it does not resolve or go away, progressive, meaning that it tends to worsen over time, type of condition. And there are two types of AMD, dry and wet. Dry AMD is the slower changing, earlier form of the disease that puts you at risk for developing wet AMD. Wet AMD is the sudden change or advanced form of the disease. AMD affects an area of the retina called the macula, which is responsible for detailed central vision used for activities like reading, driving, and seeing faces clearly. In dry AMD, changes occur in the cells of the macula, and drusen, or deposits, build up in this area. These changes may induce blurry vision, such as difficulty seeing sharp details, both up close and from a distance. Dry AMD is the slow form of the disease with changes you may not even notice over time. Most importantly, dry AMD puts you at an increased risk of progressing to wet AMD. Over time, the size and number of these deposits can increase, which increases your risk of developing the more sight-threatening form, wet AMD. Again, dry AMD can suddenly change to wet AMD without any advance notice. If you convert to wet AMD, abnormal blood vessels grow under and into the retina in the macula. These blood vessels leak fluid and can sometimes bleed without any warning. You may not notice changes until significant vision loss has occurred. If you convert to wet AMD, significant vision loss can be rapid and severe. Symptoms of wet AMD include distortion or straight lines that look wavy, and dark spots in the center of your vision, or generalized blurry vision, as you see here on the screen. Unlike dry AMD, there are effective treatments for wet AMD, but these treatments are most effective when administered early on before symptoms are noticed and vision loss has occurred. These treatments can halt or slow the progression of wet AMD, but they cannot restore vision that has already been lost. Once the wet disease starts, it will continue to advance until you receive treatment. Irreversible damage can occur within days to weeks and before symptoms are noticed. But how early is early detection? Once symptoms of visual impairment are noticed, those wavy lines or dark spots appear, then vision loss may have already occurred. The earlier you catch wet AMD, the better chance you have of preserving your vision and your independence. So, wet AMD treatments are most effective when the disease is caught early. 4C Home is an early warning system for your eyes. You use this device at home in between your regular eye exams. It helps people with dry AMD detect wet AMD before you even notice that visual changes have occurred. But how does it work? Well, you take a simple daily test that checks for tiny changes in your vision, and this test takes just a few minutes per eye per day. Data from each test is sent to your eye doctor as well as the Notal Vision Monitoring Center, the medical provider of 4C Home. If a change in test scores is detected, the monitoring center alerts your doctor. Your doctor's office will then contact you directly to schedule a follow-up visit. The Amsler Grid was developed in the 1940s and has long been recommended as a simple and accessible tool you can use from home to monitor for changes in your vision. However, by the time you notice vision distortions on the Amsler Grid, significant vision loss may have already occurred. Fortunately, new technology, such as the 4C Home AMD monitoring program, has been developed to detect tiny changes before symptoms are noticed and reports them to your doctor so you can receive immediate examination and treatment. Testing with 4C Home is easy. You turn on the device and look into the viewfinder to begin testing. A bump will briefly appear and then disappear. Use the mouse provided to click where the bump appeared and return to the center dot. Data from each test is sent to the Notal Vision Monitoring Center for evaluation and then provided to your eye doctor. Regular at-home monitoring is like brushing your teeth. It's a good, healthy habit you do every day to help preserve your vision. 4C Home allows you to take a proactive approach to protecting your vision. A clinical partner will be with you every step of the way. After the Notal Vision Monitoring Center receives a referral form from your doctor, we will answer any questions, verify coverage, and ship your device. Once you receive the device, the Notal Vision Monitoring Center will walk you through setup and training. You and your doctor will continue to receive feedback from the Notal Vision Monitoring Center. Our team will be sure to verify your insurance benefits and discuss with you prior to your acceptance of the device and getting started with the program. There are low out-of-pocket costs for Medicare patients. Patients with Medicare and a secondary supplement plan could have out-of-pocket costs as low as $0 per month. Patients with Medicare and no secondary supplement plan will pay around $15 per month once their yearly Medicare fee-for-service Part B deductible is met. Your doctor will send our Notal Vision Monitoring Center the referral order for you to begin the 4C Home AMD monitoring program. Appropriate candidates have a particular stage of dry AMD and vision level, which are determined by your doctor. You will continue to test regularly at home. If a change takes place, your doctor will be alerted and have you come in for examination. In summary, The NoTel Vision Monitoring Center works with your doctor to remotely monitor your dry AMD, helping you retain functional vision throughout your AMD journey. The first question is, how can you get this program if your doctor doesn't have it? Excellent question. I think the first thing you should do is go back to your eye care provider and mention that you attended this program and ask them if you are a good candidate. As I'd mentioned, you have to have a certain stage of dry macular degeneration and a certain level of vision. So I would first talk to your eye care provider about 4C Home. We also have information on our website, which is 4chome.com. And there is even a phone number on there where you can call in to our monitoring center. It is 888-910-2020. So if you wanted to give our team a call, we'd be happy to answer any questions you might have and share more information. The next question is, I have arthritis in my hands. Will I be able to use this machine? Also a great question. So as far as arthritis or any other concerns you might have go as far as being compatible with 4C Home, the best way to determine if you are a good candidate once you have been prescribed this service is our team will ship the device to you. Of course, we'll help with setup, and then we'll work with you to make sure that you are able to successfully take the test every day. And if for some reason, whether it's arthritis or something else going on, that you're not able to perform the test, then that's okay. You can just ship the device back to us. Our monitoring center will take care of the logistics and the shipping and everything to and from your home. So rest assured that if for some reason you're not compatible, we'll be sure to take that off your hands, take care of you. But the best way to know is just to give it a try. The next question is, can you use this device to detect additional episodes of wet macular degeneration? So a very astute observation. This is actually designed, 4C Home is for that detection of conversion from the dry to the wet kind of AMD. So once you've converted to wet AMD, then you're no longer a candidate for 4C Home because, scientifically and medically, that's not what it was trained to do or how it could help you out. But again, that'd be something that we could take care of for you from the monitoring center perspective as far as getting the device back from you if you have converted in that eye from dry to wet, or if you happen to be monitoring on both eyes and just one eye converts to wet AMD, but you still need to be monitored on that fellow eye, then we'll just make sure to notify the system to turn off the monitoring service for the wet eye and continue to monitor that dry eye because that fellow eye, that dry eye that has not converted is at higher risk and needs to be monitored very closely. What if my insurance won't pay for it? Terrific question. So we have a patient financial services team who would be able to research your insurance benefits, what, if anything, you're going to have to pay for this recurring fee for this monthly service. And so that's something that our team would discuss with you before we ever ship the device to you. So we would make sure you've got all of the information, and then we want to make sure you want to move forward with the program before we send the device your way. If it's a situation where maybe there's a prior authorization needed or some other legwork, if you will, that needs to be done to make sure that you can have this service, then our team's going to do everything in their power to work with you and your referring doctor to make sure that you can have 4C Home. But again, that would all be discussed with you in detail as part of the onboarding process working with our team. Are there false positive results? In short, yes. So every device or test is basically designed to have some false positives. We want to make sure that it's sensitive enough that it's not going to be missing any kind of disease or missing any kind of change. Whenever we looked at these results in the home study, which was a big clinical trial that was done to make sure that this was safe and appropriate and effective for patients, this actually led to the clearance of 4C Home, FDA clearance and Medicare coverage. And it showed that there was about one alert every 4 years per patient in that study. So it's fairly infrequent as far as you, the patient, are concerned with how often you may have a false positive. But what this means is that your doctor would be alerted of a change in your testing, and you would go in for an examination. Then your doctor would be able to determine what, if anything, was going on. And so worst case scenario, it's a little inconvenient with needing to go in, but it's a great touch point to have the doctor check your eyes again. And as you know, macular degeneration is a very dynamic process. So it could actually tell your doctor that something could be going on where you need to be seen more regularly or monitored more closely in the office. It's also, even though it's indicated for dry to wet conversion for AMD, a lot can happen in that central portion of your macula, the area that's being monitored. And because 4C Home is so sensitive, sometimes it will pick up on changes for other pathologies, other conditions that are happening in that area. So you'll go in and see your doctor, and they'd be able to examine your eyes thoroughly and determine what, if any, action needs to take place from there. Is there any way to self-test for early signs of dry AMD? So absolutely. And even if you're using 4C Home, this is very important to be noticing if there are any changes with the way that you're seeing the stimulus or you're seeing what's going on inside the device itself. Your doctor may have you use an Amsler grid as well. That's that piece of grid paper that I'd mentioned in the presentation, where you can check one eye at a time and see if you have any distortions with your vision. I have heard other peers prescribe just being aware of your surroundings, maybe looking at some blinds in your home on the windows, or maybe looking at door frames and seeing if you notice that there's anything different or distorted with your vision. Because even if you're using 4C Home, you want to go see your doctor regularly for exams, and you want to call your doctor if you have any changes to your vision. So it's very good for you to be very aware of what's going on with your vision. And then the last one here I have, this machine saved my husband's sight. It caught his eyes from going from dry to wet. He went to the doctor and they caught it before he lost any vision. Thank you. Every doctor should be prescribing this. Well, thank you for sharing that story. And I'm so glad to hear that 4C Home did as expected. It did what it was designed to do. And that's what we're all about. That's why it is so rewarding to be able to work with you and work with your doctors to help preserve vision. So thank you so much for sharing your story. And I think that's it, Larry, for the questions that I'm seeing, unless there are any others that are coming in. Or Dr. Gerson, hi. Any
So
comments, questions, feedback?
Yeah, I just wanted to add in a couple things because, this is something that I very regularly prescribe to patients, and just really, really wholeheartedly believe in it, that it makes a difference. And, I think probably to me, the most important question that someone asked was, what do I do if my doctor didn't tell me about this? And you made the point that it's not for everybody, right? It has to be the right stage, and you have to have the right vision. And so there's some qualifiers, but it's a great question. And now that those of you that are listening know about this, I think it's important that you're not afraid to ask your doctor. And unfortunately, not enough doctors know about this or prescribe it regularly. And boy, there's great opportunity, because you heard Larry kind of mention it. It really is, kind of a patient's journey with their macular degeneration. I think you alluded to it. And for me, if someone has, it's called intermediate dry macular degeneration, if they do, then this absolutely, in my eyes, has to be part of their journey. That you're gonna go to the wrong destination if this isn't part of your journey. So I wanted, I've been sitting here listening and watching the questions. I just wanted to add that in, because I think it's just so important.
Okay, I want to thank everybody. You could see what I mean about being empowered with knowledge. Please take a few minutes and answer the survey. That helps us for future programs. You will also find future programs on our website, which is macularhope.org. So thank you, everybody, and have a wonderful rest of the day.